Hello, everybody, and welcome. I have a great question, and I'm going to read off the question and then we're going to discuss some ideas and thoughts. So, the question goes: is this behavior the onset of dementia or depression? My husband has not been officially diagnosed with dementia yet. We are meeting with his doctors in 2 weeks to discuss his MRI. His short term memory fluctuates between okay and very poor. His behavior the last 6 weeks has started to change. He's getting agitated and angry over the smallest things. Usually when I ask him to do something. Even when I used to use a gentle tone of voice, he seems to not care or pay attention to what is going on around him. He just lays around all day and watches TV. If I disturb him, he gets angry. He no longer walks the dog at all. He did not want to go this weekend to our cabin. He usually never misses the opportunity to do that, and that has made me really worried. He just walked away from me, and I walked when I wanted to talk about this. I assume I should call a doctor on Monday. This is an excellent question, and this is what we see a lot at the beginning of when people think that Alzheimer's or dementia or the various other cognitive ailments happen, diseases. So we are going to look at this and discuss different parts of what we think might be happening. So first, let's point out that I'm an occupational therapist. I'm not a doctor, and I don't diagnose anybody with dementia or any other types of diseases. I can tell you what I've seen in the past, and getting as many thoughts and brains and different expertise together is the best thing you can do for your loved one and for yourself. First, we have to look at the person. So evaluating your husband, has something happened recently where there's been a change? Has there been a death in the family? Has there been a trauma that's happened? Has he fallen, or has there been an illness and he's gotten a new prescription for something? Are there other things that are going on in his brain that are affecting and causing something else? Because Alzheimer's or dementia is usually related to the deterioration of the brain, but there are other diseases that can cause, or deficiencies that can cause these types of symptoms. Getting blood work done to see if there's a deficiency in vitamins, or if there's a urinary tract infection, or there's many other things that can cause these behaviors, but the MRI can help diagnose or see what is going on with the brain, and if there is a deterioration occurring, or if there's not, or if there's something else going on. So that's the first answer. So the next part of the question really is, what do we do with these behaviors? If it's depression, if it's dementia, if it's anything else that's going on, if these behaviors don't change, what do we do? And I think that becomes where my specialty is figuring out what we do and how we move around it. So if your loved one is having short-term fluctuations, good or bad, some days are good, some days are bad, and that happens very frequently. We have to remember that creating things to make things easier to remember, like checklists around the house, like I have a segment on putting pictures up and words up where the bathroom is, where this is. And you can make them small, maybe having a whiteboard of things to do for the day. So then he can look at them and not have to be asked or told to do it. And then if we are telling somebody what to do, maybe asking them, can you help me do this? I'm really busy, can you help me do this? Instead of having the tone, and I know we think we're being soft and everything, But if someone is having memory problems, they are getting angry for a couple of different reasons. One, because they know they're having memory problems and they know that we all would be agitated. And the second thing is that agitation and frustration and all of that part of our brain isn't really a part of depression. Depression is a separate symptom. Agitation is a different part of our brain that can deteriorate and cause these types of behaviors. So, like I said before, depression can come and go. And depending on the type of dementia there is, depression can arrive later on because it's a different part of the brain and different chemicals that are being affected. So when agitation occurs and short tempers, that's a different part of the brain technically versus having depression. Another part of the question is he just lays around all day and watches TV, and if I disturb him, he will get angry. He no longer walks the dog at all and doesn't want to go this weekend to our cabin, which he never misses that opportunity. And this has got me worried. I would understand why this has gotten you worried. What can happen with if this was dementia or if this is something that's going on cognitively with the brain, the possibility is that with walking the dog and going to the cabin, sometimes with dementia or the beginning stages of dementia, we lose our mapping ability. And so in our brain, we have a certain routine that we do. We go out here, we take a left, we take a right in order to take the dog for a walk or in order to get to the cabin. And if you kind of know that you might not know the answer to it, you just stop in your tracks and you try not to let people notice that you don't know. So if you went for the drive to the cabin, would you drive? Would he not recognize things? Would that kind of get him upset internally and for him externally showing anger? And the other thing same thing with walking the dog. Maybe he's afraid he's going to get lost. Maybe you both could go for a dog walk together, see how he does. Can you come with me? We need to get some exercise. We need to move our bodies, those types of things. So those are types of ideas that I use in my Decoding Dementia program at Dementia Masters for people to understand that it's not just depression and it's not just getting a diagnosis of anything. It's figuring out how to deal with the day-to-day challenges and figuring out what we can do to create a better environment, because these changes will come and go. Sometimes people that are angry and depressed for a while, they come out of that part, but then another part begins repeating themselves or something else is going on, taking things apart. So there is a continuum, if this is dementia, of different types of changes that happen with the brain. And so with my program, I'm sorry, I have to, advertise it, but with my program, this is what my goal is to do, is to teach everybody how to adapt, understand the disease that your loved one has, and figure out how to make it easier for yourself and for your loved one. If you make it easier for your loved one, guarantee you'll make it easier for yourself. So I hope this helps. I know it's a little bit of information, but there's a lot of information in all questions. Have a good night and keep up the good work.